Whenever you're preparing for NEET MDS, it's always better to take advice from someone who's been there and done that. So, to give you great advice, we've got with us Dr. Aishwarya Kaushik. In 2011, when he gave his MDS exam, he got an All India rank of 5. He's also been teaching NEET MDS students for about a decade now. So he's going to tell us tips and tricks of studying and cracking for the NEET MDS. Hi, Dr. Aishwarya. Thank you for joining us today. You have been a treasure trove of all the knowledge you pass on to students when it comes to studying for endodontics for NEET MDS. So it's very great that you've taken out your time and joined us today.
Thanks so much, Doc, for having me and for your kind words, actually. I don't know whether I deserve this kind of adulation, but thank you so much.
So the first question to you is, you have been training NEET NBS aspirants over so many years. Okay. What do you think is the crucial element during the preparation phase or making a strategy for studying for NEET NBS?
So, Doc, and my dear friends, the first and foremost strategy which I feel is the most important is how hard you've studied during your previous 4 years, if you're an intern, or if you're a post intern previous 5 years. That's the first and foremost. But obviously, going into the next coming NEET, 3 months down the line, those of you who haven't studied so hard, you won't like me saying this, but yes, that is the single most important point, how well you've studied during your profs, right? During your professional exams. However, I feel the second most important thing is revision, repetition. It's the same things again and again. And as your exams go, as your exam comes nearer and nearer, you're basically relying on less of theory and more of previous year questions. But doing the same things again and again basically increases your accuracy. I think that is one single most important thing that I feel is very important. Yeah.
Great. So you're talking about repetition continuously. Now we know that when it comes to studying for any particular subject, there are certain things known as high yield topics, which you need to give your entire focus on and you need to keep revising. Could you shed a light on what are the high yield topics when it comes to endodontics for NEET MDS? Before you listen to the answer to that question, if you're enjoying this video, do not forget to hit the like button below so that it would show YouTube algorithm that you are interested in such videos and will show you more of them. The second thing is, if you want to take your career to the next level after BDS, do not forget to subscribe to our channel because we keep on coming up with amazing content out here.
So, friends, endodontics for NEET MDS, first of all, INI exam has just passed, right? So, first of all, whatever is important for INI is important for NEET. So, first of all, both are very much interlinked with each other. Your INI is primarily your AIMS, primarily, right? The AIMS faculty is making the questions for INI, and majority of questions for NEET also will be made by the AIMS faculty. Apart from that, many other colleges like MAMC, like Lady Hardinge, your GDC Chennai and Bangalore, and so on and so forth. A set of questions goes to, you know, in an equitable kind of a distribution throughout the length and breadth of the country, right? However, the majority, or you can say the importance would be the same as far as INI is concerned, as far as NEET is concerned. Now, the important topics for endo, the hot trending topics since the past 2-3 years: traumatology, regenerative endodontics, diagnosis. These are the three most important, the three pillars out of which around 60 to 70% questions of endo come. And just one extremely important thing that is a right takeaway from this last 10 days INI examination. And that is one specific, this is the golden point that I'm telling you, is your post and core chapter specifically from Ingle. Till now, Cohen was considered the standard, right, reference as far as endo is concerned, as MCQs are concerned, right? At the MDS level, yes, Ingle is important. But this specific topic of restoring a root canal treated tooth with the post and core, specifically questions were directly taken from Ingle, and at your level, at BDS level, I mean, we don't expect you to read that entire Ingle, right? So guys, please read post and core chapter from Ingle. That's like one of the key highlights, and I'm expecting a repetition of trend for at least the next 1.5 to 2 years.
Great. So now all these topics you've told, okay, are shifted towards clinical and case-based topics. If you see the recent questions and everything. So how do students who are not done a lot of clinical practice and everything, how do they tackle such questions when it comes in NEET MDS? How do you expect them to prepare and answer for it?
Doc, for this, previous year questions, image-based questions, clinical-based questions, whatever have come in the previous, most important 5 years, and if you can, and you should, previous 10 years. Like the importance of the previous 5 years is much, much more than the previous 10 years, right? So, and that's one thing, right? And the other thing, of course, I again go back to my first point. Those of you who've done well since who studied hard since your first year, second year, third year, fourth year, you will be definitely in a much better position to attempt your commonsensical, image-based and clinical-based questions better than who've, you know, only had fun. So again, but that's okay. I think as far as our students are concerned, all of you are on the same page. We consider all of you the same, whether you've studied very hard or not. I would say at this point of time, previous year questions, image based, specifically clinical based, and at the max, what happened, what you can do is you have the PDFs of your standard textbook like a Cohen. Just go through the important clinical images from that, right? You don't have to go through the entire chapters. You can at least go through the images of, say, for example, in the chapter of endodontic diagnosis, a person is sitting in the OPD with extreme pain, right? And holding an ice jar against his cheek. So that's a classic image-based clinical question. But what is the diagnosis of the tooth, right? So it's like advanced stages of symptomatic irreversible pulpitis or partial pulpal necrosis. So these are the kind of questions that come. So you can go through your PDF of your book, standard book, and just see the relevant images, right? So I think that is one thing that can be done. And of course, at DBMCI, we give you all these kind of spoon feed you in the form of our notes, isn't it? We give you the notes. They are nothing but a summary of the standard texts, right? So if you go through our notes, you're done with your image-based questions and your clinical-based questions, most of them.
I think that is honestly right. So those who have not got into the DBMCI program and are still contemplating about it, they have a revision-based program also, the Revision Pro version 2. The same things are there in that. They would give you the previous 10 years questions. They would give you 120 hours of videos. So if you are looking into that, you can even try out the DBMCI Revision Pro version 2, which is, I think, just recently out. Now you're talking about how you should go about studying for it. Okay. Now, there are certain misconceptions people have when it comes to endodontics. They feel that they have to read the entire book. What are the common mistakes you see what students make while studying for endodontics when it comes to NEET MDS?
Just as you rightly said, there is this, once you finish your final prof, you've passed your exam, there's this enthusiasm, this, back straight, full enthusiasm, open your book and start reading from cover to cover. I mean, come on, you just don't have endodontics. You have 19 subjects. I mean, even if you are to read 1,500 page novels in 1 year with your internship for 19 novels, you won't be able to practically finish them, right? And if you finish them, you won't be able to retain them. So it has to be a very, very, laser targeted study. You take reference from your previous 10-year papers, but yes, don't restrict yourself to that. You have to now go back in a retrograde manner, open your standard textbook, right? And then read those particular relevant 3 to 4 pages and make your own notes out of that, right? Take those sticky kind of, the sticky paper and just paste them on the relevant pages, right? What I used to do when I was preparing, I would actually duplicate them. I would stick those relevant things on my standard text and also from the reference MCQ question bank, so that whenever I'm doing either, it's kind of a double revision, right? So it has to be a very intelligent, targeted kind of a thing in which you intelligently do the entire book instead of reading it cover to cover. I think that is the single most important, very important way of, kind of summarizing and studying all your 4 years of study in that short duration of time. And yes, very important, as you so the strategy keeps on slightly changing in weightage when you go from 12 months to 6 months to 3 months as you approach the exam. As the exam gets nearer, you start doing more MCQs and less of theory. Yes, that kind of seesaw keeps on taking place. Yeah.
Understood. But see, there's this fear of missing out, or FOMO, as we say, because subjects like endodontics, okay, have a lot of, they are very theory heavy. There's a lot of theory to be studied in it. Even not just endo, it might be oral surgery or something. Is there any other study technique you tell them other than the previous year questions or the high yield questions while preparing for this entire thing?
Yeah, so I think, yeah, so as I said, don't restrict yourself to the previous year questions, but kind of make a mental note of what are the topics which have come. Not, it's not just the previous year questions. Nowadays, it's the trend is to previous year topics, right? So you can kind of see in the previous 10 years, okay, 20% of the questions came from post and core, 30% of the questions came from diagnosis. Within the diagnosis, most were from the, they were playing around, the examiner was playing with the sensitivity tests, heat test, cold test versus electric pulp test. And from there, you can kind of summarize and read that relevant theory from the standard text. So that kind of saves your time instead of reading entire stories from the textbook, right? So that's very important. And again, this is something that's our, this is, kind of become our job now. This is what we do for our students and present them in this form in the grand tests, in our notes, in our test and discussion, in our revision pro, and so on and so forth. I think that is what we used to do. This is what we used to do when we were studying, because we did not have this kind of hand holding and, if I say very frankly, spoon feeding. But I think in a hyper competitive world, this is what, and hyper communication, you kind of, the students are locked in on their Telegram groups and WhatsApp. I sometimes actually feel and want to tell them, guys, your concentration levels are getting hampered. I mean, it's a great way to solve your doubts, but there has to be some limited time. You cannot just be like reading at one moment and then suddenly your phone goes ping pong and suddenly you go to the phone. And I mean, what's going to happen to your concentration levels? So I think balancing your social media time is also very important.
And it's a wide technique. It's not just studying, but even concentrating, focused durations of hours was very important, rather than just ping ponging your attention here and there.
Yeah.
Great. That's really great because what students are usually advised is only about the study part. You're not advised about the concentration part, the mental models they need to focus on, how they need to study. These are things which also they need to take away. You were just telling in the start about as you go closer. Now for this NEET MDS, we have only like say 3.5 months to go. So as we get closer, there is focus more towards answering MCQs. Okay. So what do you think is the role of mock tests during the entire 12 months or the last 3 months, and how serious students should take answering these mock tests?
So first of all, as far as getting your preparation complete, mock tests are extremely important, because if you have an exam coming up, you would motivate yourself to study harder and harder and finish your syllabus. So I think that is the single most important thing that a mock test does. Second, do not get, so it's extremely important in the sense that you won't stick to that one subject. So when, for instance, those students who don't take these test series and these exams, they kind of, they're very intelligent, but they kind of get locked in one particular subject. Like anatomy is seeming interesting, and they spend 10-12 days on the, in a consecutive manner
We have
purely on anatomy. Yeah, yeah. So all of us have faced that at some point of time during our preparation, right? So I think that is the single most important thing that that regular testing does, right? You have a bird's eye view of all the subjects, because you want to do well, right? You want to get a better rank than your friends. Having said that, again, your final rank in the exam is your rank, right? So do not take your ranks in the mock tests and weekly tests and monthly tests or grand tests very serious. One reason is, again, because that's part of your preparation. Don't consider yourself worthy of that particular rank. That's another, that's very important. If you see the data, actually, what happens is that those students who are just slightly behind, not that behind, but slightly behind, they actually end up doing very well in the exam instead of just the top two, three, right? Because they kind of start digging in deeper, like working extra hard and studying extra things and forgetting the repeats, right? So I think very important to not take your ranks in the grand tests to your heart, right? Even if you're not doing extremely well in your grand test, it's a way of getting yourself prepared for that final match, right? So I think these are the two very important as far as your sense of timing speed with which you're attempting the paper, you'll end up, solving all those questions in that stipulated 3 years, 3 hours. By the same time, do not take it to your heart, if you get a bad rank.
Got it. That makes absolute sense. Okay. But now say there are only 3.5 months to go. I just started my preparation. I joined the Revision Pro program. And then there are the mock tests also in one hand. And on the other hand, there are previous year questions. Would you suggest I start with previous year questions and then prepare and then go on to the mock test? Or I do both simultaneously or focus towards the mock test and assume that the previous year questions have been included in the mock test? How would you suggest someone who's just making the final push?
So I would tell you what, when you are 3 months from the examination, you cannot compromise on the previous year questions. Yes, mock tests are important. Do those with utmost seriousness. But I always say this to my students, guys, you're a part of, say, one particular coaching institute. You cannot not do what the rest of India is doing. The rest of the country is doing all those previous year questions. They're using all those other resources, right, which are considered standard in the market. You have to also have a look at that. We are providing you with the best material at DPMCI, verifying them 2-3 times, so on and so forth. That's great. You have an added advantage. But added advantage is only when your base is when you're right there with the other students as well. So do not compromise. As part of your preparation of your mock test, do the previous year questions and do as many as you can. There's this very common doubt that students ask us, sir, how many revisions are sufficient of the previous 10-year question? Three,
Like
four,
what,
two. I like 5, 6, 7. I mean, the more the better. The more the better. There is never enough, because if you want to get a rank, there's one golden rule that my senior used to tell me. That forget about getting a top 10 or a top 5 or top 20. If that happens, wonderful. But if you want to get a rank, you cannot afford to go wrong with the repeats. It's as simple as that. So, so guys, that's very, very important. Never ever compromise on the importance of previous year questions. I don't think that you've done them twice or thrice. Now I don't need to do them. I'll remember them. Not at all. You have the time, keep on revising them again and again.
Great. That really makes absolute sense. But many times people tend to ignore it. They think that last time the topper told me 5 revisions. So I finished my 5 revisions 2 months prior and the next 2 months I'm chilling. That just cannot happen. You have to keep revising. The more you revise, especially the answers you keep getting wrong, you have to keep hitting on it. Really good advice that, and that makes absolute sense. Uh, my next question to you is, now I'm in the examination session. I'm sitting for the exam. Okay. And while answering the questions, there are certain clinical questions or case-based questions. I have prepared for them, but I'm having difficulty answering them. Is there any suggestions of how to go about answering them? Or if I just do not know it, they're lengthy answers, I just quit and do not answer them with the fear of the negative marking. What's your take on it?
So I'll tell you, Doc, what happens. One strategy that I always tell students is there are certain questions in which you're always supposed to, like, the statement would be all of the following are correct except, right? So you'll have to see all the options, right? But there are questions in which the most of the questions are in which there's a proper question based on certain theory or data or whatever. And then there are the options, right? Never ever look at the options first in those kind of questions. See the question, rotate, revolve, kind of work that question in your head 2, 3, 4 times, and then see the options. So you kind of filter out all the, irrelevant information that is there, and you you know, kind of reach a targeted kind of 2, 3 relevant important points. Because what happens is that the examiner makes these options in a very confusing manner. What happens is, see, the idea of cracking a competitive exam is matching the answer. The answer is there, right? So matching the answer to the question or matching the question to the answer. All right. So um, you read the question, don't see the options first, except for obviously that situation in which you have all the following are correct except or whatever. Because what happens is you have one option, the other option would be from some another chapter. And you would have read that chapter. And you would say, I've read this. And you've read this, but that's not the answer to that question, right? So never see the options first. Right. So never see the options first. So that is one thing. Second thing, as you said, that if you just don't have any idea, I'll tell you what I used to do in a new question, not a repeat question. If I was able to kind of eliminate two options, and out of two options, I had a very strong feeling about one, I would mark it. As simple as that. But if out of four options, I'd got no idea, I would leave that question. If out of four options, I would have eliminated one definitely, but out of three, I was still confused. I would leave it. From two options, and if I have a very strong inkling towards one option, I would go with my gut feel. Right? So that's extremely important. I think yes, showing some kind of determination, taking some calculated risk definitely helps improve your rank. So, for instance, I was fortunate enough to get All India 5 in my time in 2011. So there were a few questions which I did not revise, say lately or recently, but I knew that I've read this somewhere 4 years back in a standard textbook. Of course, I cannot clearly recollect, but from my logic and whatever, from going through it again and again, um, I would kind of reach that one answer. I would go for it. And fortunately, I was lucky enough to to get more right out of wrongs as far as that kind of risk taking was concerned. Another very important theory, Doc, if you may allow me, there's another strategy while revising. What I used to do when you've done four, five, six revisions and it all seems very monotonous, do one thing. While revising your previous year questions, read all the four options, don't see the question, and then guess the question. So that's another mental mind exercise which helps you in increasing your accuracy in a repeat. So that is what I used to do, and that is what I always tell students at DBMC. Do this. Once you've done 4, 5 revisions, instead of, so reducing the monotony, increasing the, accuracy, just see the options and guess the question.
This is basically a type of active learning technique which would force your brain to make it more tough, and then you end up remembering the answer more. I love those tips you told me about first answer, just looking at the question and trying to know the answer, and then looking at the options. A lot of times we just first look at the options and then you're like, oh my God, now I'm confused. That's a great good suggestion you have given out there. Now, before we end this, if there is any golden rule you have to give to someone who wants to follow your footpath, maybe not the fifth rank, maybe the top 100, what would be the golden rule of preparing for NEET MDS?
Golden rule would be, again, I would say, um, not answer. Even if you are 100% sure of the answer, don't lock it in the first go.
Oh.
Read the question one or two or three times. See, guys, very frankly, Doc, this is not a physics paper. This is not a maths paper. So frankly, I never ever felt paucity of time during attempting these papers, right? So you will always have enough time. I mean, if your reading speed is okay, not extremely fast, but even if it's okay, you will never have ever have paucity of time, right? So take a deep breath, give yourself adequate time to kind of run through the question two or three times in your head. Again, as I said, don't look at the options. Uh, Shortlist the answer, then look at the options, reach the right answer, and then again take a deep breath and then lock it, even if you're 100% sure. That really reduces your negatives. Second, yes, one golden rule. I would say previous year questions again and again and again and again. I think getting as much accuracy with your repeats. Just one more thing. Lastly, what happens is that we don't get these papers out of the examination hall, right? So all our question banks and all our, whatever resources that we have in the market are based on recall value. So many a times it's the wrong questions which are being published, and for years and years we are looking for the right answer to the wrong question. So guys, please, first of all,
Read the question.
key to your resource. Yeah. So, you will never have the right answer to the wrong question. So, please, guys, see to your resource. Your question should be most accurate. Your answer will definitely come out, right? From some reference or the other. So, even in the previous year questions, if you feel, many a times there are certain questions, a handful of questions which are just completely wrong in your most popular textbooks in the market. I won't name them. Please don't stick to that and waste your time. So please don't stick to those and waste your time and bang your head against the wall, right? Just leave them, right? Or go with the most popular answer, because as I said, the rest of India is going to get that wrong. So you can't be behind them, right? So please, yeah. So no undue stress on such extremely controversial questions. Try to first of all look at the right resource. Be at DBMCI, do that kind of testing 2, 3, 4 times, verify that. So we try to be as pinpoint as and as targeted to, getting you the right, correct version of the question. And then of course the answer follows. So again, the importance of PYQs and accurate PYQs. Right answer to the right question. I think that's very important.
People don't tell that aloud, but yes, everyone knows there are certain books with certain answers always wrong. And through generations, people know that answers should have been changed, but the book keeps printing it the same way. We all have been there and have seen that. Thank you, Dr. Aishwarya, for such a customized interview of how someone can easily crack the NEET MDS. And those who are interested in joining the DBMCI, check out our description below, in which we have given the entire details. They have a revision version Pro 2, which is out. You can sign up for that if you have not signed up for it. Like you're planning to give it next year, you can go in for the entire full year of course, which comes up with notes and everything else. Thank you, Dr. Aishwarya, for taking out time and joining us today. If you liked this video, do not forget to check out our other two videos. You'll enjoy them as well.